I'm Hans. I'm one of the co-founders of NURX. I'm a computer engineer and a lawyer, and this is Eddie.
I'm a physician from back home from Norway, and I talk to the other doctors on the platform as well as do operations.
We say NURX. We tried to make it into just one word, but call it whatever you want.
The idea is new, and RX being the abbreviation for prescription.
So right now we're based right here in San Francisco on 7th and Folsom Street, and we're operating in all of California and all of New York State, but we're trying to expand to more states very quickly. Broadly speaking, we take every type of insurance except for Kaiser Permanente. However, there are some HMO plans and managed care plans that are more difficult than others for us to work with. So for instance, if you have Orange County Medi-Cal, you still have to pick your prescription up at a local pharmacy, but we can write the prescription. So to get PrEP with NURX, we require exactly the same labs that everyone else requires. So what that means is that if you get PrEP with NURX, we take a rapid HIV test and a confirmatory HIV test, which will be a 4th generation assay for those in the know. And we do a creatinine clearance test and a hepatitis test. In addition to that, we also do screening for sexually transmitted infections and a pregnancy test for women. On the STI testing, for people who already have a regimen there, if they go to Magnet every 3 months, they can still do that, but we can also help you get the testing done right through NURX. So right now they can go to LabCorp or Quest if they have private insurance, and that's the easiest. You can drop right in there. If you don't have private insurance, you can go to SF City Clinic. It doesn't cost anything, and we get the lab results. And we're also working on some really awesome outreach ways where we'll drive a phlebotomist right home to you to draw your blood and collect the swabs that are necessary.
Do home testing.
So just like if you're getting PrEP from your doctor or from an infectious diseases specialist, you need to redo your tests every 3 months. So you have to go back to LabCorp or City Clinic every 3 months to get those tests redone, or alternatively we can send someone out if you're in an area where we're doing those tests at the moment. And for the STI testing, obviously it's the same. You need to monitor it ongoing. So that's a really good question, because bottom line is they are required, but we won't cut anyone off straight away. So if you miss your tests by a few days, you're not going to be without your PrEP pill. So then we might write you a shorter prescription and call out and reach out to you and make sure we get you into testing. But that's a really challenging situation because some people are hard to follow up with and get on their labs. So it's a really difficult situation because we want them to keep their PrEP, because taking their PrEP away just means that they're at more risk of HIV, but also not following up on their labs puts them at risk. So we try to balance those two risks to get the best outcomes.
So we basically disclose the information that the user agrees to. So if the user wants us to talk to the primary care physician, we give all the information to them. If they prefer not to, then we let the user decide that.
And so the bottom line is, if you don't want us to talk to your primary care physician, they will never know that you used our service, and they will not get any information from us.
Yeah. Absolutely. So we do push notifications to the users to ensure that they take the pill when they're supposed to. We also provide messaging to make sure that the users adhere to when they're supposed to do STI testing and good follow-up care. So if the user at some point wants to get additional information or has some questions that they need answered, we have a HIPAA compliant built-in messaging system where they can interface and talk to a physician on an ongoing basis.
So basically, if you miss a pill or anything, we're just a message away. Basically, we've worked with the San Francisco Department of Public Health, a lot of community figures and experts on this, and we've really tried to make sure that the service is as gender neutral and open as possible. So sort of in the really simple way, we ask you what your gender at birth was as well as what your current gender is. But beyond that, we've really tried to not distinguish between genders, so everybody gets asked all the same questions, so that we're not slotting people in based on sort of traditional notions of gender. And we designed the service so it works for women and men, and we've been really aware that people who are transgender are some of the highest risk of HIV and some of the people that have the most difficulty getting PrEP. So it's been really important for us to take care of that, but we're always open to suggestions. So anyone who sees this video, please let us know if you have any better ideas for how to handle this for us.